The Indian Council of Medical Research has detected 2 cases of human metapneumovirus in Karnataka. Both cases were identified through routine surveillance for multiple respiratory viral pathogens as part of ICMR's ongoing efforts to monitor respiratory illnesses across the country. However, there is no clear information whether the Chinese type of HMPV virus and the virus found in the child are the same. Karnataka Health Department said as per reports, child and parents have no history of travel to China. The first case is a 3-month-old female infant who was diagnosed with HMPV after being admitted to Baptist Hospital in Bengaluru with a history of bronchopneumonia. She has been since discharged. The second case is the 8-month-old male infant who tested positive for HMPV on January 3, 2025 after being admitted to the Baptist Hospital in Bengaluru with a history of bronchopneumonia. The infant is now recovering. It is important to note that neither of the affected patients have any history of international travel. Meanwhile, Health Minister Dinesh Gundu has called for an emergency meeting with Health Department officials today to discuss on the precautionary measures to be taken. Health Department had earlier made it clear that HMPV virus is already present in India, but what is unclear is that the strain of the virus that is currently causing concern in China, if it is present in India. The rapid spread of HMPV virus cases in China and beyond have resulted in pandemic scare across the world, including India. The virus is being compared to COVID-19, which also began in China 5 years ago. The symptoms of HMPV include cough, fever, nasal congestion, and wheezing. Several cases can be reported, and several cases of bronchitis and pneumonia have been reported in China. Currently, no vaccine or effective medication against the HMPV has been there, and there's a lot of speculation on how the virus in fact spreads, and also there's facts about the virus as well. An enveloped single-stranded negative sense RNA virus, which was first discovered in 2001. It spreads through close contact with infected individuals via respiratory secretions or by touching contaminated surfaces. Now, children, elderly, and those with compromised immune systems, particularly the vulnerable, are at risk. Amid the pandemic scare, a list of do's and don'ts have been also released by the Karnataka government to ensure safety of the state's residents. Now, Delhi health authorities on Sunday have issued an advisory to ensure preparedness for potential health challenges related to the HMPV and other respiratory viruses. Kerala Health Minister Veena George has said that they are carefully assessing reports of global viral fever and respiratory infections. While there is no need for panic, the minister recommended that pregnant women, the elderly, and those with serious illnesses wear masks as a precaution.
कोई नया वायरस नहीं है, ये बहुत सालों से है और कुछ लोगों को ये मिला होता है, खासतौर पर बच्चे लोगों को भी होता है और जो जिनका इम्यूनिटी कम होता है उनको इसका इन्फेक्शन हो सकता है। तो इसीलिए इससे ये कोई नया ये नहीं है कि जैसे अखबार में आया कि पहला केस है, ये पहला केस नहीं है, बहुत सारे केसेस है और बहुत सालों से है। तो और जिसको भी उतना सीरियस फेटेलिटीज भी नहीं है इसमें। तो हम देखते हैं, अभी मीटिंग है, मीटिंग के बाद में कुछ नहीं, 2001 से डिटेक्ट हुआ था, उससे पहले भी है लेकिन 2001 इट वाज डिटेक्टेड इन नेदरलैंड्स। तो इसीलिए ये दिस इज नॉट अ न्यू, नया वायरस नहीं है। चाइना में जो है वो क्या है, वो उसका डिटेल्स गवर्नमेंट ऑफ इंडिया को मालूम है, लेकिन इनका जो जिसको हुआ है वो कहीं बाहर नहीं गए, इधर के लोग ही हैं और कहीं बाहर ट्रैवल करके इधर नहीं आए हैं। तो अभी तो वी शुड नॉट गेट वरीड टू मच। सब ठीक है, सब ठीक है, और वो बच्चा जो है वो कल डिस्चार्ज मेरे ख्याल से हो जाएगा।
Meanwhile, the first case of HMPV virus has been reported in Gujarat as well. A positive case of HMPV virus has been reported. This was the report of a 2-month-old child that came positive. The child is being treated in a private hospital in Ahmedabad. Well, we are joined in by Dr. Sanjay Rai, Professor, Department of Community Medicine, AIMS, New Delhi. Dr. Sanjay Rai, what is your initial assessment of the HMPV virus? There is speculation saying that it's already been there in the population, but is it the same strain as concern being caused in China? That could be there is something they are trying to, in fact, find out. But what do you think about our preparedness when it comes to the HMPV virus?
Thank you, Mr. Verghese, for having me here. See, this virus is not a new virus, as reported by many that a new virus has been identified in China. No, although it's detected in 2001 in Netherlands, but if you see the history, there are a lot of publications, research publication on this virus. And if you see the history, many sero survey, even in late 50s, they reported antibodies, presence of antibodies in human blood. So this is not a definitely new virus. So it's not like your COVID. Like COVID was completely a new virus. Any prediction about the COVID was very difficult that time. How disease will progress, but we know many things about this virus. Lot of publication, even in primates, vaccine testing has been done long back, if I recall correctly, almost 6 7 years ago. Uh, right. So we know about this virus, and the overall pathophysiology of this virus, and the causative agent of this virus. So these all are in the public domain. So anything, any prediction should be based on the what evidence we have generated in last 20 30 years for this virus. So the evidence, whatever evidence we have, we can say it's a mild disease, just like a common cold. Sometime may be fatal, like may cause lower respiratory infection. So this virus may cause upper respiratory infection also, lower respiratory infection also. So if causing lower respiratory infection, then that may create some problem, like may require oxygen support or some other support. Right. Otherwise, it's a mild disease related to immunity. If you see, the long-term immunity is usually not reported, so reinfections may occur, but usually in reinfection cases it's a mild, and symptoms are just like your flu-like symptoms. So I like symptoms, we say I like type symptom, influenza like symptoms, same common cold, sore throat, some mild fever, etc. So these are the symptoms. So I don't think there is need to be panic. Yeah, definitely we must monitor this. Monitoring is okay, so a good surveillance system, and most probably we detected these cases in our country because of good surveillance system. After this COVID episode, all over country now we have established a good surveillance system for the respiratory virus, and most probably because of that reason we detected this. Otherwise, this virus is present in the community since long. So community is not an entirely virgin community for this virus. Yeah.
Well, Doctor, now there's concern saying this Chinese variant or a variant of this particular virus. We were talking about how the situation in China is. Again, it is quite opaque. The WHO has also not been able to give some kind of an understanding of how the situation is in China. These viruses have an ability to mutate itself, and it can become more infectious in a way. So, is that kind of a situation that we could probably guess from the little information that we have in China?
Yeah, till date, whatever we have, either from the WHO or from the China has shared some information. Based on that, we cannot say that it's going to cause a major problem. See, uh, this is RNA virus, and their mutations are bound to occur in all RNA viruses. It's a single strand. So when replications occur, because of some error in that replication, it's mutate, and then mutations. So it's not first time mutations are occurring. Mutations have already occurred several times. This time, whatever they have said and in the public domain, see, any prediction can be based on that only, the evidence we have generated, either few days ago or in last 20 30 years. Uh, the whatever evidence we have, we can say the evidence is it's a mild disease. Still, it's a mild disease. They have not reported lot of deaths even in the China. And if its mortality is very low in this type of disease type, either RSV or your this human metapneumovirus, so mortality is very low. So I don't think that there is a need of any type of panic situation. Yeah, definitely monitoring is important, and next few days will really govern the progress of this disease, and then we can predict, because of the incubation period is very low. See here, incubation period is not more than 7 days. So 3 to 5 days, 6 days, it's the average incubation period for this virus. So that means after getting infection, after 3 to 4 days, you will develop symptoms. Like in COVID, the incubation period was from 7 days to 2 weeks. So in long incubation period, you have to wait. Here it's a short incubation period. So I don't think that and currently there is need of any panic. And the second, very soon, within the 2 week, you will know that this is not going to cause a major problem or going to cause a real problem. So we should maintain our surveillance system. We should strengthen our surveillance system to detect this type of cases, and not only this, any new virus cases which is of respiratory origin or is causing infection through droplets, and then only it can spread now. So chances of pandemic is only if it's spread through either droplet or your fomite. So this virus also infects others through droplet only.
Yeah, so doctor, what
Yeah.
should immunocompromised people do? I mean, those who have poor immunity or who have compromise when it comes to their immunity, what are the measures that they will have to take? Because it was one of the biggest concern group when COVID has also broken out.
Yeah. See, in immunocompromised, all infections, either any viral infection, even any bacterial infections, they may cause serious problem, right? Because the immune system is not up to mark. So they may cause problem. So just like any other virus, this virus also can cause problem. But based on the history, even in the immunocompromised patients, if you compare with the immuno good patient with immunocompromised patient, then definitely the problem is more. But even in the immunocompromised patient, it's not causing very serious problem. Like all immunocompromised patient are having problem, or they need hospitalization, etc. So till date, whatever evidence we have, we can say even in this group, the there is chances of having more severe problem than the normal person. But overall, it's a mild disease, so it's not causing very high mortality or high hospitalization rate or high severity rate, even in the immunocompromised patients. Yeah.
Well, stay with us, doctor. Now, we were just talking about WHO. Now, just like COVID-19, China led World Health Organization's deafening silence on the spread of human metapneumovirus or HMPV, a respiratory illness with flu-like symptoms, is worrisome. Like in the case of COVID, WHO has yet to issue a statement on the outbreak of the virus in China, and no state of emergency has been declared by the global health body or Beijing. Now, the spread of the disease in China has raised health concerns globally, with countries closely monitoring the situation. Photos and videos of people wearing masks in hospitals in China have emerged online, triggering panic. Now, China has, however, downplayed the rise of infections, stating that respiratory infections tend to peak during the winter season. Now, the outbreak comes 5 years after the outbreak of the deadly COVID-19 pandemic. Another pertinent question is that, is HMPV virus similar to that of the COVID-19? While both can cause respiratory duress, the HMPV and SARS-CoV-2 belong to different viral families. The similarity that they may share is only in terms of virulence, fatality, and occurrence. Both the viruses are known to target respiratory systems. Both HMPV and COVID cause mild to severe infections depending on a person's immune response. Both of these viruses spread via respiratory droplets and contact with contaminated surfaces. Fever, cough, sore throat, wheezing, and shortness of breath are common symptoms for both. The only big difference between the two can be seen in the treatment available for the cure of the two. While there is vaccine available for the prevention of the severe outcome of COVID-19, there is none at present for HMPV. Well, like in COVID, WHO is silent on the HMPV, who's yet to, in fact, declare its stand on HMPV, and WHO has not yet issued a statement on this. Now, the question being asked is China hiding something on the HMPV? HMPV virus threat is, in fact, triggering panic as more details of the spread emerges on social media, and visuals are also coming in from social media, and therefore most of the countries are now closely monitoring what is happening in China. Well, the two cases have been reported in India, both of them with regard to infants, while one more case has been reported in Gujarat, and all these three cases are being now monitored. In the first case, the two cases that were reported, the first case, the child has been, in fact, the infant has been discharged. The second case in Bengaluru, the infant is undergoing treatment and is recovering, is what we understand at the moment. Meanwhile, another case has been detected in Gujarat, and this time the positive case of HMPV was reported in a 2-month-old child. The child is being treated in a private hospital in Ahmedabad. Well, most of the health authorities are saying that the virus has been in circulation in the Indian population. Now, the question being asked is whether it's the same strain as that is being reported in China. All eyes are on China as the HMPV cases, in fact, rise. China has, in fact, downplayed the incident, saying that respiratory infections do rise during the winters, and however, has said that they are looking into the matter. Meanwhile, the silence on the part of WHO is something that is being looked at. Meanwhile, there's been an effect on the markets with regard to the HMPV. HMPV has spooked markets. Sensex crashed over 1,300 points as India reported the new virus strain. For more on this, we are joined in by our colleague Shweta. Shweta, what is the situation on the ground when it comes to the markets?
Well, Varghese, it looks like markets are tanking as we speak. Both Nifty and Sensex have fallen over a percentage point. What we are given to understand that markets are spooked at the moment, and it could be due to India reporting its first two cases of the HMPV or the Human Metapneumovirus. Now, both Nifty and Sensex are down. Nifty, in fact, has fallen to 23,700 levels. Sensex has dropped over 1,300 points as we speak. A variety of reasons, of course, being attributed to what could have resulted in that fall. But the biggest reason coming to light right now is the fact that there has been an outbreak reported in the state of Karnataka, where an 8-month-old baby is seen to have contracted the very first, HMPV virus, and it's a case that is being reported. Markets don't like uncertainty, Varghese, and it looks like this is as uncertain as it gets. Over the course of last 1 week, we've been hearing reports of how HMPV outbreak is being reported in China, in various parts of China. Hospitals are flooded, public health infrastructure is crumbling in China. There's been no confirmation from China over the last 1 week, but today, this morning, we have reported India's very first case of HMPV, and that could be resulting in spooking investors and sentiments at large. Another, a reason that is coming to light right now is, of course, on the back of US President-elect Donald Trump's oath-taking ceremony, which could also be strengthening the dollar, weakening the rupee, and also weakening Asian markets. And India could be reflecting that weakness in the Asian market right now. So of the two reasons why Nifty and Sensex Indian markets have crashed and tanked this afternoon, HMPV being one and weakness in Asian markets being the other.
Well, Shweta, also now when we're looking at domestic investors, they have been in fact looking at some of these challenges that have been there in the international market. But how do you think that investors are in India are looking at this particular point of crash? Because we did see that when last time the crash came in, a lot of them picked up, the domestic investors in fact picked up when the foreign institutional investors were leaving. But this time it looks like the domestic investors also would be holding their purse strings.
Absolutely, and you're right to point out, in 2024, we have seen a net outflow when it comes to FPIs or foreign institutional investors from India, and domestic equity investors have been supporting Indian markets, but there seems to be some sort of reversal towards the end of 2024, and that is continuing as we speak. There is very little to no support coming in as we speak today, where both Nifty and Sensex are down 1 percentage point. As I mentioned earlier, investors are never prepared for an event like this. Nobody is really prepared for an event like this, and this is quite naturally reflecting in the knee-jerk reaction that we are seeing in the markets. Now we'll of course have to wait as to how this pans out at market close, whether investors will continue their sell-off or whether it's a temporary blip, something that is spooking the markets now. But as situation stabilizes, as we get more clarity from both Karnataka Health Department, the central government on the cause of the spread, on how deadly the virus is and who's likely to be impacted, there could be some stability going forward. But for now, you know, Varghese, details are very sketchy, and that doesn't make investors very happy.